It's the news that health officials in Quebec have been fearing. Tests have confirmed there is an outbreak of measles north of Montreal. A health authority statement says so far 10 cases have been identified. None of the patients, by the way, was vaccinated. CBC's Ainsley McClellan is on the story live from Montreal. So what have you found out about these cases, Ainsley?
Well, what we do know so far, Suanna, is that they are all linked. All of these 10 cases happen in the same region, in the Lanaudière region, which is just northeast of Montreal. And health officials indicate that the source is the same source that has caused so many problems all across the states, and that is the outbreak in Disneyland in California. They indicated that at least one of these 10 people had recently visited what they just called a park in California, but we can assume that they are talking about Disneyland in this case, and that was the source of bringing this outbreak back here, because all of these 10 people know each other, that they have contact with each other in the Lanaudière. And of course, that Disneyland outbreak so far has caused 114 cases across 7 states. So now we're seeing that the spread has made its way here to north of Montreal.
Now, as we mentioned, none of these patients was vaccinated. What information do you have on that?
We don't know the reason for that, whether that was a choice or whether it just happened to be that they weren't. We also don't know whether this is a combination of adults and children, or whether it's all children that were affected in this case or all adults. What we do know is that here in Quebec, that the vaccination rate, the protection rate for measles is only at 86%, and that's compared to 94% for chickenpox, 96% for mumps and rubella. And the reason for that is that in order to be fully protected against the measles, you have to have a booster shot. Here in Quebec, the original shot, measles, mumps, rubella, is given at 12 months, and then there's a booster shot that comes in at 18 months for measles. That's been happening since 1996, but a lot of parents are not necessarily aware that they have to get this, or they just don't go back for that second shot. So that contributes to that lower level of protection against measles, and that's a problem considering that in order to get that herd immunity, you have to be up around 95%. So we have some questions for public health on this about how they can improve those rates. We're hoping to speak with them a little bit later today.
All right, thank you, Ainsley. Ainsley McClellan in Montreal.